so if we've got limited dorsal rostral expansion, I'm going to give you an opportunity to do that first. But if that doesn't work, then a lot of times we can actually free this area up manually. So we'll see deficits in all of our ER measurements like flexion, external rotation. We'll see differences in hip flexion, and even in the suboccipital region, like we've talked about in the past. And so let me just show you how to decompress the scap from the thorax and allow for dorsal rostral expansion to occur. So I'm going to put this between us because I got to get really, really close to you. So you just kind of like pick your arm up and just flop it over my arm. And so what I got to do, Nikki, is I have to push my chest against the front of your shoulder. But I need you to just go flop before me. So this is just a dead arm. And what I'm going to do is I'm going to just get up underneath your scapula here. So I'm going to put my chest against the front of our shoulder, okay? And if I passively retract the scapula over my hand, you just gotta let yourself go there, okay? And then I can just slide my fingers right up underneath the scapula. So Mike, you might need to get in here really, really close just for a second so people can see that, okay? And so I'm gonna put my chest against the front of her shoulder. I'm gonna take my other hand and I'm gonna start at the lower end of the medial border, so near the inferior angle where my other hand is. And I'm just gonna work my way up, and I'm gonna bump into most likely rhomboid minor, which tends to be a little bit stiffer in the upper dorsal rostral area. But what I'm going to do is I'm going to lift up and away from the rib cage. So my hands are underneath. I lift up and away. So now I'm basically just creating space. So I'm manually, eccentrically orienting the spinoscapular muscles on this left side. I'm just going to create space, and then I'm just going to cue Nikki. Just take a nice breath in through your nose, and out through your mouth, and I'm just going to hold that up. And so I'm just creating space for her. And then once she gets used to that, what I'll do is I'll follow her breath. So she breathes in, I'm going to downwardly rotate. As she breathes out, I'm going to upwardly rotate, and all the while pulling the scapula off the rib cage. So again, breathe in for me, a little downward rotation action. She breathes out, a little upward rotation action. I'm pulling up off the thorax. And if you roll back to your back, knowing that you always have this shoulder limitation on the side, it should be even better than it was before. Yeah. And so again, it's just a lot more comfortable. So that's the scapular decompression.